for that reason. Hey, it's Dr. Buford. We're just getting started on the right shoulder. We're looking at from the back to the front. You're laying on your side, so your arm is up in the air. The humeral head, or the ball part of the ball and socket joint's the top half of the screen here. Your glenoid, or the socket part of the joint's the bottom half of the screen down here. And what we're seeing here, as we take our first walk through, is this is the biceps tendon. As we look down at the biceps anchor, this is the area we were worried about. And here you can see how loose this is. This is what we call a slap lesion. It's what the MRI scan showed. It's what your history and physical exam suggested. And we're going to take care of that for you today. See how that reaches or lifts off. Can I get a crochet hook? Thanks. I'll just demonstrate the laxity or the instability. See how that lifts off like that? That's a problem, and we're going to take care of that problem by doing a biceps tenodesis. There's other options, but in my experience with what you like to do for a living and your activities and your age, the biceps tenodesis has the best long-term result. But that is what a type 2 slap lesion looks like here. As we look up at the rotator cuff tendon, the rotator cuff looks great. This is the rotator cuff up here. No signs of any trouble here. There usually isn't if we're dealing with a slap lesion like that. This is the back of your shoulder. There's the posterior band of the inferior glenohumeral ligament down there. That little fold right there in the middle of the screen. We can look at the capsular insertion into the humeral head. That looks great. No signs of any articular cartilage problems. And then as we look down the front of the shoulder, the anterior ligaments looks just great. Here's the anterior band of the inferior glenohumeral ligament. We're going to rotate the camera. We'll get a good look here. This little wispy thing is all you have of the middle glenohumeral ligament. That's the middle glenohumeral ligament right there. Behind that, right here, is the subscapularis tendon. So we're going to go ahead and take a pair of arthroscopic scissors right now and release this biceps tendon as the first step in our tenodesis. So we're going to release it right at the base. And as we go ahead and cut across, very quickly, you'll see how that biceps is now gone. So now that can no longer pull on the labrum there. That takes care of that problem. We're going to use our shaver here just to smooth out some of the tissue that's left. And then we'll show you some more in just a minute. Okay, so what we're doing here is we're using our shaver to remove the cartilage. This is an important step if we're going to be reattaching this labrum. As we rotate around, you can see that there's cartilage here all the way over the top of the glenoid. So that's not going to repair or heal down to cartilage. We've got to expose the bone below. And we'll know the difference because the bone starts to look reddish or even yellowish. You can see it there. Now we're down to bone. And taking off that cartilage is a critical part of the labral repair in this part of the shoulder. Because we need to have something to heal to. So I recognize we've taken off the biceps tendon, so the question is, why are we doing this? And the reason is this labral tear is so extensive that in probing it and looking at your shoulder motion, it looked like it was still going to potentially get caught in the joint. See how it was unstable like that and could displace into the joint? And when we rotate your shoulder, we know that that can happen. So we're going to anchor this down and take care of that problem for you. So that looks pretty good there. One second. Okay, so we've placed a double-loaded anchor. This is our suture hook coming in here. It's loaded with a black wire called the super shuttle. We're going to pull back and basically do a very similar type of stitch to what we do for a slap repair, because we're doing the same thing. We're repairing the labrum. There's the first pass. We'll feed the relay through a bunch, and then we'll back the needle out. We'll retrieve it here, and then we'll show you some more in just a minute. Pause. Here you go. Okay, so we've got the first suture passed. Since we used a larger anchor, we've got another suture we can use here. We're going to use a slightly different angled hook. To try and make a stitch right back here. You can see how this, if I can demonstrate it, this is still a little bit loose. See that? So we're going to try and two hands on this. Hold right there. Okay, so we're going to try and come through right about here. And we'll show you some more in just a minute. Pause. Okay, so there's our second stitch. We'll feed that through a bunch, back the needle out, and we'll go ahead and retrieve the relay here, just like we showed you before. Okay, pause. Here you go. Okay, so we've got two sutures holding down this labrum. It looks like it's more stable now. I'm going to trim the inner edge just a little bit, and then we're going to go to the open tenodesis part of the case. So that'll be the end of the video. But right now we're just going to trim a little bit here. Okay. So I think that's better. I was worried about the stability of the labrum, and having those two sutures in makes me feel a bit better. Hopefully it does better for you clinically too. This is going to be the end of the video because everything else we do is outside the shoulder joint. So good luck to you now, okay? Bye-bye.